Good afternoon, everyone. Is that too loud? Welcome back from lunch. I'm Mark Fucello from the Office of Planning, Research, and Evaluation, and this session is ACF's Career Pathways Evaluation Findings. What have we learned and future directions for the field? ACF's evaluations of career pathways programs really are leading some of the most interesting federal investments on this topic. And our panelists will present some critical interim findings in this important body of training and employment studies. And then their presentation will be followed by remarks by a federal leader in evaluation of employment and practice and policy. But before I introduce them all, I'd like to share a few thoughts about where this research fits into our broader interest in employment intervention and policy research. You're going to hear about the Pathways to Advanced Careers in Education program first, and that really is an important project because it started several years ago by talking to a broad group of stakeholders. I think perhaps over 200 people like you sitting in the audience, federal policymakers, state officials, employment and training program designers. The aim of this remarkable team at Abt Associates was to understand at the time what the field believed was necessary to move people substantially up the career ladder, how to truly improve employment outcomes and make some sizable impact in earnings among people who are struggling to gain a foothold in the labor market. That work is ongoing. We'll see over the next few years how those goals may be achieved, but what you'll hear today are some interim findings that show that we're on the right path to getting there. So while this team developed these several tests of employment, of occupation-focused programs that really built on the resources that community colleges have been devoting for years to help people find their way into the labor market. As this work was being crafted, the Health Professions Opportunity Grants program was authorized under the Affordable Care Act, and ACF, the Office of Family Assistance that runs the TANF program, was given the responsibility of putting out grants that in most ways followed the logic and framework that the PACE program had already developed. David Fein here has a paper of several years old that I'd advise you to look at on our website that lays out what the logic is of these kinds of programs for individuals who really are struggling to gain a foothold in the labor market. The Health Professions Opportunity Grants program then provided the opportunity to receive federal funding to implement these kinds of approaches. So while the PACE demonstrations were moving along, HPOG, as we call it, provided this wonderful opportunity to see what would happen if funding becomes available. We often don't have the opportunity as we're testing out individual programs. We often don't have the opportunity to see very soon, well, what if we made this kind of funding available broadly? What would happen? How effective would they be? And Laura Peck will present the early findings from what we're learning from the first round of grantees. So before I introduce them, I just want to say a word about where this kind of work fits into our broader set of questions, some of which were discussed first thing this morning. How do we help people who really have no hold in the labor market? And for as long as this question of securing employment for recipients of safety net benefits and other low-income individuals has been part of the public debate, there has been a tension between finding the right dose of employment and training weighed against a requirement that people get jobs quickly. And we continue to hear that. And part of that tension is due to the policy debate about how to operationalize an employment obligation for individuals against what are critical empirical questions about what is best for vulnerable families and children. If a short-term investment in training can be shown to more likely improve job retention, and dare we hope wage growth, then what set of program tools and interventions should responsible program administrators turn to if sustained employment is the goal? So this is really the first discussion on this body of evidence in this conference. There's going to be many more sessions, so I'd like to run through them so that you can mark them down. Today at 4 p.m., you can get a closer look at early impact findings from ACF's Career Pathways portfolio that will expand on the content of this plenary and present the HPOG early impact findings in more detail, along with subgroup impacts and implementation findings from PACE. Tomorrow at 10:15, both evaluators and program leaders involved in the PACE project will discuss how evaluation informed their program decisions. This session will be of interest to not only practitioners, but also researchers working with programs, as well as policymakers who wish to apply research findings to practice. At 1 p.m. tomorrow, you can hear about strategies to accelerate educational achievement and labor market success, where findings from 4 randomized trials demonstrate that it is possible to achieve large gains in post-secondary training and college completion rates. On Friday at 8:30 a.m., OPRE staff will explain how multi-use management information systems can be developed and can enhance data-driven learning, and in particular, how they've been applied to these career pathways programs. And at 11:45 on Friday, colleagues from the Department of Education will discuss how data from the Program for the International Assessment of Adult Competencies, or PIAC, can be used to analyze young adult skills, followed by presentations of findings from Year Up, a leading employment program for low-income youth. And now on to our panel. David Fein is the principal associate at Abt Associates and has led many technically demanding random assignment evaluations of interventions promoting self-sufficiency with low-income populations. Trained as a demographer, he brings a strong multidisciplinary orientation to his work. David Fein's technical expertise spans qualitative and quantitative methods with a focus on improved measurement of educational progress, psychosocial skills, couple interaction, and census undercount. Dr. Fein is the principal investigator for the Pathways for Advancing Careers in Education project. He holds a PhD in demography and sociology from Princeton. Laura Peck is a principal scientist at Abt Associates and has over 20 years of experience evaluating social welfare and employment policies and programs. Dr. Peck specializes in innovative ways to estimate program impacts in experimental and quasi-experimental evaluations and applies this expertise to many social safety net programs. Dr. Peck is the principal investigator, co-principal investigator, and director of analyses for several national evaluations of U.S. Departments of Health and Human Services, Labor, and Housing and Urban Development. She is director of Apt's Research and Evaluation Expertise Center. She earned her PhD from the Wagner Graduate School at New York University. And our discussant today is Molly Irwin, who is the Chief Evaluation Officer for the U.S. Department of Labor, where she is responsible for coordinating the department's evaluation agenda and working with all DOL sub-agencies to design and implement evaluations. Dr. Erwin has more than 20 years of experience planning, leading, and conducting large-scale research and evaluation projects, and working with policymakers, researchers, and practitioners to build and use evidence with the goal of improving public programs. She has more than 8 years of federal government experience in 2 federal evaluation offices, DOL's Chief Evaluation Office and in OPRE at ACF, where she designed and oversaw the launch of the National Evaluation of the Health Professions Opportunity Grant Program. Prior to coming to the federal government, Dr. Erwin led research projects in local and state government, the private sector, and academia. She holds a PhD in social welfare from the Mandel School of Applied Social Sciences at Case Western Reserve University. And with that, I'll turn it over to David.
Good afternoon. In my presentation, I'll be summarizing highlights from the first round of impact reports from the PACE evaluation. Launched in 2007, PACE is the first rigorous study to apply a career pathways framework in evaluating promising employment and training programs for low-income adults. But before getting to the presentation, I'd like to thank the many people and organizations who have contributed to the study. Most importantly, they include OPRE staff, a number of foundations, the Abt team, our colleagues at Abt Associates, staff at the 9 programs that PACE is studying, and the thousands of participants who shared their experiences with us in interviews. PACE is a set of 9 separate evaluations of promising approaches to occupational training for low-income youth and adults. All these programs aim to boost skills needed to access and progress in well-paying occupations. But their service strategies and target populations, occupations, and career levels are quite varied. Given these differences, and because the 9 programs don't represent a single policy or funding stream, OPRE and the PACE team decided that it would be most appropriate to evaluate each program on its own rather than pooling the entire sample. To help structure the overall investigation, we've applied a framework of concepts and principles known as career pathways. The team has used this framework to guide site recruitment, to classify and describe programs, and to develop hypotheses and measures for key study outcomes. In a moment, I'll outline one key element of the framework, a stylized career ladder. But as Mark mentioned, you can read more about it in papers on our project's website, www.careerpathways.org. In this presentation, I'll give a quick tour of early impact findings for 9 programs. To measure impacts, each program randomly assigned 500 to 2,400 eligible adults to treatment and control groups. Program staff encouraged treatment group members to enroll in the program. Control members were not allowed to enroll, but could receive training and other services available in the community, and many did so. So PACE is a test of whether particular strategies lead to better outcomes than the usual services. In the interest of time, I'll be focusing mostly on results for education and training outcomes. Except for one program, these were the focus of our most important hypotheses at the 18 to 24-month follow-up interval covered in the first round of reports. Future reports will put more emphasis on employment and earnings. For each program, we'll look at findings for a single outcome selected to best test whether it was producing its desired results. We call this the confirmatory outcome. And we'll look at impacts on receipt of 2 kinds of credentials, college credentials and industry certifications and licenses. Our data sources vary by outcome and program. They include an 18-month follow-up survey, college records from local institutions and the National Student Clearinghouse, and wage records from the National Directory of New Hires. To make it easier to move through the results in my allotted 15 minutes, we've grouped the 9 programs into 4 clusters based on the main steps and outcomes they target on a stylized career ladder. These are rough groupings, and although they help to sort the PACE programs, other programs out there may well involve other combinations of steps. I'll describe each set of programs and findings in turn. As you can see in the exhibit, this career ladder starts with basic academic skills remediation and extends through a baccalaureate degree. Steps in between illustrate the core career pathways idea that training should be organized as manageable steps leading to successfully higher skilled jobs. At each step, there are possibilities for exits to employment and returns to education and training at a higher level. The first cluster of PACE programs includes several programs that focused on relatively low-skilled adults. Workforce Training Academy Connect at Des Moines Area Community College aimed to provide a bridge to the college's short-term occupational certificate programs for adults whose skill levels normally would not have qualified them for such training. The program emphasized self-paced remediation, coaching, and other supports. Bridges to Employment in Healthcare in San Diego and Health Careers for All in Seattle amplified individual training accounts provided through the Workforce Innovation and Opportunities Act, or WIOA. Local workforce agencies use supplemental funding from the Health Professions Opportunity Grant Program, or HPOG, which we'll hear more about in the next presentation, to contract with local providers for short-term training in healthcare with enhanced career coaching and other supports. All 3 programs in this first cluster focused on short-term training, typically training lasting just a few months. So given this focus, we selected receipt of any credential as the main indicator that impacts were heading in the right direction at 18 to 24 months. The left-hand chart on this slide shows the percentages who received any credential in the treatment and control groups for each program. The number in the brackets show the difference between treatment and control groups, that is, the program's impacts. Well, as you can see, impacts for Des Moines and Seattle were small, about 4 percentage points, and only the Des Moines result is statistically significant at the 90% level with a one-tailed test. In contrast, the San Diego program produced a large 29 percentage point increase in credential receipt. Arrows on the right-hand chart here show just the impacts for receipt of 2 kinds of occupational credentials: college credentials on the left and industry certifications and licenses on the right. The arrows show that impacts mostly were small. The exception is the large orange arrow showing that the San Diego program substantially increased receipt of certifications and licenses. These were mostly certifications for occupations like nursing assistant, phlebotomist, and medical records technician. The next cluster of findings includes 2 programs that sought to create bridges to college-level occupational training. PACE results for the Washington State IBEST program apply to 3 colleges in Washington and are the first randomized control trial results for this well-known program. The key innovation in IBEST is its use of 2 instructors, one teaching technical methods, technical material, and one helping with basic academic skills in key courses for an occupational program. The idea is to provide quicker access to occupational training than the traditional approach of requiring basic skills remediation before training. The Patient Care Pathway program at Madison Technical Community College in Wisconsin also targeted lower skilled adults. It provided 1-semester academies as bridges to 1- and 2-year college programs in healthcare. This new program was still finding its legs during the PACE period, and it didn't create a substantial contrast with business as usual at the college. Our confirmatory outcome for these programs was the average number of college credits received after 18 months of follow-up. IBEST generated a large increase, 11 credits, more than doubling average credits over the control group. Nearly all of this impact was for so-called workforce credits rather than regular college credits, as the programs operated in the college's workforce divisions. The Madison program, on the other hand, had only a tiny and statistically insignificant effect on credits. The right-hand panel here shows that IBEST also generated very large increases in receipt of both college and industry credentials. And this is the green arrows again, where the Madison program had no effect on either type of credential. The third cluster includes two programs that aim to boost entry and progress across multiple steps in healthcare careers. This is really getting more directly at a program that can bridge multiple steps. The first of these is the Chicago Carreras en Salud program, which sought to engage low-income Latino adults in a 7-step career pathway leading to licensed practical nursing credentials. Carreras offered its own training at lower rungs and used community college courses at higher rungs. Pathways to Healthcare was a new HPOG-funded program at Pima Community College in Tucson. It focused on mapping and guiding students in pathways through the existing college curriculum. Both of these programs also provided extra financial assistance and other supports. We selected hours of occupational training as the confirmatory outcome for these programs, since it seemed too early to place the main bet on credentials. And hours provided a way to summarize the amount of training across 4-credit and non-credit courses. The two programs produced statistically significant increases in hours of training of about 45 to 65 hours over an 18-month follow-up period. And not shown in the exhibit, they also increased hours in basic skills remediation by a good bit. The Chicago and Tucson programs both increased receipt of short-term college certificates, primarily from nursing assistant programs, but only the Chicago program boosted professional certifications and licenses. It did so by a substantial 18 percentage points. The final cluster of PACE programs included two programs that focused mostly on entry and completion of substantial single steps into middle skilled jobs that required at least a solid year of post-secondary training. Both programs were run by experienced nonprofits, used well-known models, and required full-time training. VITA in South Texas provided intensive guidance and financial supports to promote full-time college studies, leading to 1 to 2 year college credentials in occupations with strong local demand. Several other programs also use this model. Originally, it was developed for the Project Quest program. A recent random assignment study of Project Quest found that it produced substantial increases in earnings over a 6-year follow-up period. Operating from standalone offices in 9 cities, Year Up targets economically disadvantaged young adults aged 18 to 24 who finished high school. It provides 6 months of full-time training in IT or financial services, followed by 6-month internships with major employers and post-program employment services. Consistent with VITA's emphasis on college persistence, our main indicator for early success was the number of college credits received. Since Year Up put a strong emphasis on career track employment after 1 year, our confirmatory outcome was average total earnings in the 6th and 7th follow-up quarters. The left-hand bars in this exhibit show that VITA produced a statistically significant increase of 6 credits over the period. And Year Up generated a $1,900 increase in average quarterly earnings. The Year Up impact is quite large. In fact, it's the largest impact on earnings that have been reported for a workforce program tested through an experimental design to date. Turning to credentials, we see that VITA increased college credentials but had no effect on industry certifications, whereas Year Up had no impact on college credentials but substantially increased certifications, and these were mostly in IT occupation for IT jobs. And as Mark said, there will be more about VITA, Project Quest, and Year Up in other sessions at the conference. Altogether, to sum up, 7 of the 9 programs had statistically significant impacts on the primary outcome we selected to confirm their early success. The results suggest that varying approaches to promoting first steps in career pathways can improve education and training outcomes. Some of the effects we've seen were modest, while others were quite substantial. At this point, except for Year Up, we don't know if these impacts will be enough to increase earnings. A longer time horizon is needed to see if careers are really underway. The next 2 rounds of PACE reports, covering 3 and 6 years of follow-up respectively, will focus on employment and earnings and assess further progress in education. Well, there wasn't that much great information on the last chart. It was all our contact information and where you can go to find the reports. I guess that is pretty important. There it is. So I mentioned the Career Pathways org website earlier. The PACE team sought to test programs that seemed promising. Though the results provide some evidence on efficacious strategies, they're not typical of any single approach or funding stream. A sense of their tenor thus requires looking at the results for each individually, and doing so in 15 minutes has required moving fairly quickly. I hope, though, that this brief taste of the 9 PACE flavors has whetted your appetite for reading the PACE reports and attending other sessions on PACE at this conference. Thank you.
Good afternoon, everyone. My name's Laura Peck, and I'm the co-principal investigator for the HPOG Impact Study, the health profession. Oh, that's the very last slide. Let's go to the beginning. The Health Profession Opportunity Grant Program. Mark and David have both referenced that, and I would like to recognize OPRE as the funder of the HPOG research, and OFA as the funder of the programs. I also would like to recognize my co-principal investigator on the study, Alan Warner, and our ABLE project director, Gretchen Locke. And I'm here as a single representative of this large team that included many people at Abt Associates and at the Urban Institute. And so I feel honored to be able to tell the story to you today. I'm going to tell you very briefly what HPOG is about, who participated, and what it achieved in the 15 to 18 months after study entry, and discuss briefly the implications. But as Mark and David have both noted, there are other sessions at the conference, including one this afternoon, that will delve more deeply into some of the program impacts. So HPOG, as designed, has 2 main policy goals. First, to provide training in the healthcare sector for low-income individuals and TANF recipients, and also to increase the healthcare labor supply in local labor markets. And this harkens back somewhat to Ohio's Cynthia Dungy's comments from earlier this morning, how she works to connect with employers to figure out what it is that they really need from a trained workforce. HPOG follows that model in connecting closely with local labor markets to figure out what's needed and provide that kind of training. And it does so in a career pathways framework, which involves targeting those skills and competencies demanded by the healthcare sectors, not just generally, but specifically in those local labor markets. It involves trainings that ideally result in portable credentials, certificates, and licenses that are valued by the industry. It combines the education and training with rich support services and connects participants to employers to give them kind of a sector-grounded experience in the community. And so where did this operate? Well, HPOG operated in, the first round of grants actually went to 32 grantees, 27 non-tribal grantees nationwide that served more than 33,000 people. The programs that are part of the impact study include 23 grantees that operated 42 distinct programs. And as you can see on this map, it identifies that they were operated through 3 kinds of administering agencies. The stars represent the locations where there was a workforce agency as the administrator, workforce investment boards. Those are sprinkled all over Kansas, for example. A government agency or nonprofit agency were the lead grantees in the places marked by squares, and then circles there indicate that an institution of higher education, predominantly community college, was the administering agency. So as David noted for PACE, the HPOG evaluation also used an experimental impact evaluation design to ascertain the program's impacts. And it did this by all those places that were just on the map. They took eligible individuals and randomized, in total, almost 14,000 of them to gain access to HPOG as part of the treatment group, or to be part of the control group that did not have access to HPOG, but did have access to other kinds of trainings and services in the communities. And so the difference in the treatment and control experiences is what's represented by the program's impacts. And as both Mark and David noted already, PACE was an evaluation that selected 9 promising programs to evaluate in kind of a standalone way, and HPOG is quite different from that. As Mark referred to it, it's the evaluation of a funding stream. And what we have in the setting of the HPOG evaluation is a whole collection of programs that are quite diverse, and we're kind of looking at the average impacts of that diversity of programs. And the way that we get to that is by looking at the differences in outcomes between those in the treatment group relative to what would have happened in the absence of HPOG, which is what's represented in the control group. So who were the people that came into HPOG? Well, on average, they were 32 years old. 89% of them were women, 63% had at least one child, and 84% were unmarried. At baseline, 12% were receiving TANF and 56% SNAP or WIC. Also at baseline, 88% of them had completed at least a high school degree or equivalent, and over half, 54%, had some kind of post-secondary or education or training as of the baseline time point. Importantly, 43% of the study participants were employed, and this is in sync with kind of the career pathways nature of the program, intending to provide people additional education and training as they propel through a career, not just giving them training to get yet another job. So as implemented, the kinds of trainings that people participated who were in the HPOG treatment group tended to be shorter term, 2 to 3 months on average, and these were the most commonly enrolled in programs that train people to become nursing aides, orderlies, or attendants. And the longer-term trainings that people received trained them to become licensed vocational nurses or registered nurses. And although these were less commonly enrolled in, they're part of the kind of diverse package of services that were offered across the HPOG programs nationwide. These tended to be longer in duration, 8 to 9 months for those who completed. But I should note that almost 2/3 of those who enrolled in a longer-term training were already in school at baseline. Now, an important part of what distinguishes HPOG from what was otherwise available in the community are the support services. And indeed, the HPOG programs offered a wide array of support services to help people stay in school and improve their outcomes. So let me tell you, with respect to these training and service participation outcomes, what HPOG produced in the short term. So I'm going to show you a couple of graphs that look like this, so I'll take a moment to orient you to it. What we have here is the blue bar on the left-hand side represents the level of the treatment group, the HPOG group, and the gray bar on the right side represents the level of the control group. And the difference between those two, the blue number on top, is the difference in those levels, or the impact of HPOG, and the arrow up above shows what the relative impact represents. So I'll give you an example. The far left columns are the levels at which the treatment and control groups enrolled in training activities. And there it shows that 71% of those who had access to HPOG enrolled in training as of the 15 to 18-month follow-up, compared to 62% of those in the control group. And that 9 percentage point difference represents about a 15% increase in training participation for those in HPOG relative to the control group. So the next three sets of bars there are represent different kinds of support services, and you can see that the relative impacts of those are even larger still. As I mentioned, the HPOG, what distinguished HPOG from what was otherwise available in the community were its rich support services. And so you can see that across career supports, academic supports, and other support services, there were meaningfully larger levels of service participation among those in HPOG relative to the control group. So this is kind of what people experienced relative to what would have happened without HPOG, and what we want to know from here is what did this produce in terms of the priority outcomes of interest for the study. So I'm going to take one moment to tell you what those outcomes of focus are. First, we're looking in this particular impact study at a 15 to 18-month follow-up window, or about 5 quarters. And the main outcome that we look at, David referred to this as the confirmatory outcome, is that we're using to identify the extent to which the program is really achieving progress towards its goals. And the one that we chose to prioritize for this study is educational progress. And we defined that as having completed or still being enrolled in training as of the follow-up. Other outcomes that we look at include employment, job quality, public assistance use, and earnings. The data sources that we have include a participant follow-up survey, and National Directory of New Hires data gives us information on employment and earnings outcomes. And just as with the PACE evaluation in the longer term, the study will additionally emphasize earnings as a priority outcome. We look at it right now, but put greater weight on educational progress. It's sort of closer in the logic model in terms of what we expect to see happening at 15 to 18 months. So I guess the big result that you've all been waiting for, HPOG, in terms of its educational progress, does indeed appear to be moving the needle in the right direction. 67% of the treatment group and 60% of the control group had made educational progress by our definition as of the 15 to 18-month follow-up, and the 7-point difference represents a 12% improvement in the treatment group over the control group. So that's great news. Next we see that there is we're looking at the difference in employment here. And as of the 5th follow-up quarter, although there's no difference in the level of employment overall, HPOG did appear to create a meaningful shift in the sector of employment, with a much greater share of the treatment group being employed in the healthcare sector. We also see that the HPOG group was more likely to have a job that offers health insurance, a sign that they're getting better quality jobs than the control group. And although there's no difference in their use of public assistance as a follow-up, we do see that despite the lack of detectable impacts on overall employment, the shift in employment seems to have led to an increase in earnings. The 5th follow-up quarter shows that the treatment group had a small increase of about $137 in that quarter, 4% more than the control group. So the key takeaways that I have for you today are that HPOG, again, this constellation of diverse programs nationwide, resulted in an increase in educational progress, an increase in employment in healthcare despite no detectable change in employment in general, no impact on public assistance use, and a slight increase in earnings. I'll posit a couple of implications for practice, but hope that you will share your thoughts on this in our Q&A. We observed through the study that the major area of contrast for HPOG really was the offering of rich support services. In terms of the program as implemented, most participants chose to be in shorter term trainings, which are associated with quicker employment for sure, and are also part of a career pathway and may support longer term training over time. I also want to make the point that what I think we've learned from the HPOG impact study is that it's possible and even beneficial to embed an evaluation, a rigorous evaluation, into program practice, and that can result in valuable learning. The next steps that we have to look forward to are that the intermediate and longer-term follow-up research projects are underway, and we'll be assessing impacts on further educational progress, further career progress, employment, earnings, and family and child well-being after 3 and 6 years. I look forward to your questions later, and I also want to put in a plug for my colleague, the study's Director of Analysis, Eleanor Harville, is going to be giving a presentation that goes into all sorts of juicy subgroup impacts later this afternoon. So go attend that if I've piqued your interest here. Oh, and I'm also supposed to mention, within a short week or two, I think the report itself will be available on OPRE's website and at the careerpathways.org website, and we hope that you will download it early and often and read it and enjoy it and love it and share your thoughts. So thank you.
Hi, everybody. I am Molly Irwin from the Department of Labor. I think as Mark said up front, I came into federal government 8 years ago as a fellow and thought I would stay in Washington, D.C. for about a year and then go back to academia. And that was when ACA was passed and HPOG came into effect. And I ended up taking a job, working for Mark, working on HPOG, and here I am 8 years later. So it is really exciting to be here to see initial findings from this study. And it's also really exciting to be in a position now at the Department of Labor to look at these findings, not only from these studies, but across this body of evidence more broadly, and think about how do we build this into our programmatic strategies and how do we continue to build evidence in this area so that we can have better trained workers with better outcomes and meet the needs of employers. So it's really exciting to be here today, and I thank you for inviting me. I want to take a few minutes just at a high level to give a few reactions to the studies that we just heard. And then I want to talk a little bit about what we're doing right now at the Department of Labor, looking across this body of evidence and thinking about where we go next. And then I'll have a few thoughts about implications for research and practice going forward. So I want to start by saying I think this body of studies at ACF is really impressive in a number of ways. This is a big investment, and I think was really thoughtfully put together to balance a number of things. I think as everybody has already alluded to, between PACE and HPOG, we both have a set of studies that went out and found promising practices and is looking to see if they work and how they work, and a funding stream where we have a number of projects that are pooled where we can see, does this investment by the federal government make a difference? And Laura didn't talk about this too much, and I'll talk about it a little bit more later on, but HPOG gives us not only the opportunity to look at the average effects across all of these programs, but also within the design there are some 3-arm tests and some non-experimental work that's allowing them to get inside the black box a little bit and start to answer questions about what works for whom, which is really, I think, important in this field, especially because, as you heard, especially in David's presentation, these programs are really varied. They're varied in what they're doing, they're varied in who the partners are, they're varied in who they're serving. So getting inside of that and understanding how these are working and for whom they're working is really, really important. I think one of the things that's also really exciting about this is the long-term commitment. What we heard now was 15 to 18-month findings. There'll be 3-year and then 6-year findings as well. So this is really important to understand over time what difference do these programs make, again, both to the earnings and employment of the folks that are served, but also to the labor markets where they're being served. So long-term studies like this, especially so many of them, is unusual, and this portfolio is really strong because of that. And the long-term outcomes are especially important because, again, I think what we saw today in these short-term outcomes is that these programs seem to be working in making impacts in service receipt and credential attainment. What we need to understand is how that translates then to impacts on unemployment and earnings. Since these programs have started, as everybody in this room knows well, there has been a lot of focus on career pathway programs and a rapid increase, I think, in programs being implemented for a number of reasons, because I think of early promising findings, but also because there's been an emphasis on them in a number of places, including in the WIOA legislation that talks quite a bit about the importance of career pathway models. Also in the WIOA legislation was a requirement that the Department of Labor do a multi-site study of career pathway programs to understand how they're working, especially for low-wage workers in early care and education and healthcare. So what we wanted to do, and what I want to spend a few minutes talking about, is before we move forward to meet that legislative requirement, because we knew there was all of this work underway, we wanted to take a step back and award a contract to really do a scan of the field, understand the current state of the knowledge, and understand what studies were currently in the field and what questions were being answered, so that when we meet this legislative requirement, we could be building on all of that work. So we, in 2016, awarded a contract to Abt Associates to do that work, to really look at and do a scan of what we know now, what we're learning from all of the studies, and what design options there may be for moving forward to fill gaps in the literature and to meet this legislative requirement. And I want to talk a few minutes about some of the things that that contract found out. And there are a number of reports that have just been posted on our website that you can look at. So what the study team did was looked at career pathway studies and initiatives that were implemented as of February 2017 and consulted with a number of experts and came and developed a number of different reports, including a career pathway research and evaluation synthesis, which looked at 52 studies and did a big matrix that looked at, that laid out for all of those studies the research questions that they're answering and the timing of reports. It looked at career pathways. It also did a synthesis of programs and looked at 128 different programs, and again laid out a matrix with detailed information on all of those programs. And then the final piece was this evaluation design options to help us think through how to fill the gaps in the literature. And a number of, I think, really interesting things came out of that. The synthesis showed that of the 52 studies, 23 were only complete at the time of analysis, and that was before any of these findings. had come out. 10 more impact studies were going to be released in the next year. I think we just heard from the 10 that were going to be released. So there are still many, many studies that are in the field right now looking at impacts in career pathways that will be released in the next couple of years. It found, and this is Laura and David have just confirmed this, that most of the studies found positive effects on educational outcomes and employment, and mixed effects, positive or mixed effects on earnings and employment, but generally within a short to medium time frame. So again, I think this really underscores the importance of these studies, looking at long-term findings, and the importance of continuing to build knowledge in this area and tying it to the longer term. I think another thing that was really interesting is of the 128 implementation initiatives that they looked at, those showed a stronger focus on career advancement out in the field than the 52 programs that are currently being evaluated. So one of the things that the initiative that the scan really showed was that many of the programs being evaluated weren't fully developed career pathway programs, or weren't programs where people going through them were going through more than one step in the chain. And what this found was the programs not being studied, those initiatives out there, may be more fully developed than the programs that we're currently studying. So I think that's really good news, that we're learning, that the programs in the field are continuing to improve, and that we're not maybe fully capturing that in the literature that we have. So ongoing studies also aren't addressing a number of questions, or aren't fully addressing them. We still, I think, need information on career pathways, programs and approaches in sectors other than healthcare, manufacturing, and IT. HPOG, of course, is all healthcare. The majority of the studies and the initiatives out there are in those industries. So if we want to know about other industries, we need to look at other programs. We still know relatively little about the effectiveness of particular components or implementation strategies, or we haven't really gotten in the black box as much as we would like to know if these programs work better for certain populations and certain industries and certain geographic areas. I think, again, this is something that HPOG is starting to do, but something we really need to think about how to do this more and better, especially, again, because these programs are so varied. And I think we still don't have a lot of information on many populations. In many cases, studies were too small to look at subpopulations. There will be some presentations about this in the next couple days. But we don't have that information, so in many cases. And then we still, I think, need more information on the return on investment of career pathways to individuals and to employers. And we need more information on this match between what we're training in and the skills in demand. So where do we go from here? How do we take what we know now from the studies that we've just heard, from all of the other studies and programs that are out there, and incorporate it and continue to learn as we go? I think there are a few important things that we should be doing. I think we need to think about how we can leverage data across these studies. I think in order to really understand the relative effectiveness of components, models, implementation strategies, the relative effectiveness of these approaches on specific people or sectors, we need really big samples. HPOG has that. Most studies don't. In addition, I think in a time where there may be fewer evaluation resources, we need to be thinking about how we can leverage data. So how can we be taking data from the studies that are in place and thinking up front about what we need to do from the beginning to make sure we have informed consent, data sharing agreements, MOUs, so that we might be able to do longer term follow-up of folks in studies or link or merge data down the line. I think we need to be thinking about program administrative data. This is another thing that Laura didn't talk too much about, but one of the things that HPOG did from the beginning, working closely with the program office, was think about the program administrative data, the performance management system, and setting that up in a way that it would collect data that could be used both for performance management and for evaluation. I think we need to be thinking about those things from the beginning. I think some of this is made a little bit easier with the WIOA common measures, which now many DOL discretionary grant programs are using, but thinking up front about data that we are collecting and how it will be used down the line is really important. I think a couple more things. I think we need to think about how we balance what we're learning for continuous improvement with the need for evaluation. I think there's a real importance in studying implementation along with impacts so that we can know how programs are operating and so that we have information to give back to program operators along the way. And I worry, and I think, I challenge the researchers in the room to help us think through how we continue to push on methods so that we can continue to build evidence in an area where these programs are blooming everywhere. I think when we do impact evaluations, we're comparing the results to business as usual, and in many cases, career pathway programs are becoming business as usual. We have a number of discretionary grant programs where we're having a hard time picking sites because in every site that we look at, there's already an HPOG grant or another similar career pathway program. So I think it gets harder to do this, and we need to think about ways to do that. And then the final thing that I'll say is I think these studies, and maybe PACE particularly, did a really good job from the beginning of building partnerships with the programs. And I think we need to think about how we continue to do that, how we do that better. I think the session tomorrow with some of the PACE program operators will give us lots of insights there. But in the end, the goal is that we're putting programs in place based on the best evidence that we have, and we're evaluating them and then building what we learn back in. And to do that, it's got to be a partnership between the researchers and the program operators, and this conference is exactly what that's all about. So hopefully together we can continue to think about how to do that. Thank you.
So I invite you all, members of the audience, to ask questions of our panelists. If you have a question, just step up to one of the microphones. And while, oh, go right ahead.
This is a question for Laura Peck. Hi, Laura. I was curious that you said that there were different agencies who implemented HPOG in different sites. So I was wondering if you found that certain agencies had better results in certain situations. For example, if it was a community college agency doing this program, they ended up finding a little bit better results as it comes to education outcomes, as compared to, say, workforce development agencies found a little bit better employment outcomes. So if you could talk a little bit about that. Thanks.
Sure, is this on? You can hear me okay? So I happen to know who that is, but you didn't introduce yourself to everyone. That's Rucha Samudra. and we, the report that is forthcoming in the next couple of weeks has a quite substantial appendix, and those results are in the appendix. And I have to say, it's not a set of results that I've committed to memory, but Ellie Harville might have committed them to memory, so we can track her down at 4 o'clock today after your poster session and find out more about that. But I want to say that there are not remarkable differences across administrative types, but that there are some differences in relative impacts between programs that offered shorter term versus longer term programs. That's a little misleading. I'm not being precise with my language. Programs where the larger proportion of the programs that people enrolled in were shorter term rather than the larger proportion of people who enrolled in them were longer term. Those tended to have slightly larger impacts on some of the outcomes. So there is some variation going on, and Molly made the point too that this is a total variation fiesta. There are lots of dimensions of variation in the HPOG program world, and we've tried to slice it in a lot of ways in the report. So I don't want to take all of the Q&A time, but I will hope to follow up with you and others interested in that topic later today.
Yes, sir, please.
Yes, hi, my name is Romuald from APHSA. I have a question for David. In one of your slides, you show, a graph when you have, the 4, strategies on the x-axis, and on the y-axis you have, a stable employment and good paying job. You have like a linear type of association, but your study don't look at employment outcome. So how do you expect to have a linear relationship between training and employment when your study only look at training?
That's a good question. The illustration, that figure is a heuristic kind of a picture. It's not a model of any particular program, but what it's doing is it's showing the space that programs are variously operating in. And it's emphasizing the point that there's a relationship between skill and the kinds of jobs and the qualities of jobs that people can get. So programs can try to chart a path through that space by varying combinations of training and different kinds of training at different levels, and employment experience and work experience. So among the many questions that need to be unraveled in all this is exactly what combinations and sequences of employment and training works for whom. But this model, the main sort of insight that people are now intrigued by is the idea that you don't just do you don't ask everybody to take one big giant step in training before they're going to come on the job market with a 4-year degree, but rather that for many people increasingly, the kinds of jobs that provide a good start in the labor force are jobs that require more limited increments of skill, which then potentially we can build on. So it's a heuristic device, and programs are going to vary in how much emphasis they put on the skills and work. I don't know if that helped.
Yeah, that helped. And just a quick follow-up. So in case that, you down the line, include, good paying job, has, an outcome that you intend to measure, well, how would you operationalize a good paying job?
Well, a good paying job is through earning, mainly through wages and hours. When you're working full-time at a good wage, then from an earnings perspective, that's a good job. And if you're able to stay employed as such and gradually increase wages, that's basically, the kinds of outcomes that these studies are going to be measuring over time.
But add to that, good, I think it sounds like you're asking whether good, there's a particular number that you would associate with good.
Yeah,
and I know that in our 3rd and 6th year follow-up, we're kind of grappling with that, trying to figure out, is there a level that we can put on that, or is it relative to where they started? So that's, we may have a more precise answer for you the next time you ask that question, because it's something we're trying to operationalize.
I wanted to comment on the last question briefly, and maybe even, invite other people to weigh in on it, because I think the question of what kinds of providers are going to be the most successful in career pathways interventions is a great question. There's a perspective on this that is more systemic, which we didn't really talk about very much, but career pathways has a sort of a systemic nature or meaning. We've been talking about programs, but the broader idea is that it takes a village, and that different kinds of organizations which come from different systems and different policy environments all really need to be part of this problem of fitting people and training and jobs together better. So it is interesting, and I think it's a great follow-up, research area in the long term is what are the unique and special capacities and advantages of college systems, of the workforce system, and of the nonprofit organizations. And, that would be something great to discuss more. I mean, I have ideas about that, and we've seen a lot of wonderful strengths and some also limitations in each of those spheres. So that's, I think that's the broader answer to that question would be a longer and interesting conversation.
I believe we have a question from a live stream viewer.
There we go. This is from a RECS Live participant. Laura, you reference a difference in increased support services in career and other categories. Can you clarify what those support services entailed?
Sure. There's a the kinds of support services are, because there are lots of different HPOG programs, they have lots of different categories, check boxes to check for that. But there are things like tutoring. On the kind of academic side, tutoring services, for example, financial assistance and helping people access financial assistance is a whole set of services, providing case management and career guidance. And then there's also a whole set of kind of additional financial supports like childcare, referrals to childcare assistance, emergency assistance to help people with eviction prevention, transportation assistance. So there's really quite a diverse package, and it's going to depend on the particular program, what they offer. But those are some examples of the kinds of things that, that HPOG programs generally offered across those many categories.
Julie?
Thank you very much for the great commercial you're doing for getting us to delve into all your detailed studies. I am having a little trouble hearing some of the questions, so I really hope I'm not repeating anything. But I have a question for Laura that may be a little more detailed on the implementation side. But I noticed when you were presenting impacts and you said that there were no impacts on rate of employment, but there were impacts on the shift into the healthcare field, which presumably was the goal, or one of the goals. So the question I have is, was that in any way related to the fact that people, that you were recruiting from people who were already incumbent workers somewhere, not you personally?
Right. But generally, yeah, so that's one of the things I didn't have the opportunity to say quite so explicitly, so thank you for the question. But if you look at the levels of the control group outcomes that were on the pictures that I showed you, they're pretty high. There's a high level of employment, high level of educational progress, and so HPOG kind of had a high bar to surpass. And it did, and not hugely, right, because they were already at high levels. And so there's a lot of variation in this across many programs nationwide, but in general, the counterfactual that's represented in the HPOG impact study is one of relatively good counterfactual condition. And this goes to one of the comments that Molly had made too, that our business as usual in some cases sort of doesn't lend itself to identifying big impacts, right? But what we've identified here is some ways in which the HPOG model can improve upon what's already a pretty supportive environment. Now, that's not the case exclusively. There are definitely some locations that had much lower levels of offerings, but on average, they were pretty good across the board, and HPOG improved upon that.
So now, just can I understand more, though? I understand that it was a high bar, but I'm also asking, is some of this that that the programs were recruiting, the college programs were recruiting from companies or places where people were already employed and looking to move up?
There were relatively few incumbent worker programs that were part of HPOG, though they did exist. But generally, these are people, for example, from all of the community colleges. A lot of them were already in school. Their application to HPOG wasn't necessarily their first foray into this kind of training, and they didn't get into HPOG, but they took something similar, maybe even at the very same community college. And in some cases, they may have been in the same classes as the HPOG participants, but didn't have access to the support services.
I see. Thank you.
Larry, and then Hans.
These are the most positive findings I've heard about a career progression program in a long time, so it's really quite encouraging. But my question is whether programs of this sort could be taken to scale. Now, the response I heard from the last couple of questions may, in a way, suggest that they've already been taken to scale, that the baseline for this area of activity is actually quite high already. So I guess the question to ask is, if there were a full implementation of this model, assuming it continues to be successful, how much gain would there be over the baseline? And would it be worthwhile? These are big questions that you're, I realize, not in a position to answer at this point, but it's worth looking ahead to that.
I actually think that's what HPOG represents. It is a kind of taking to scale of what are some promising models that are under more kind of scrutinous focus within the PACE evaluation. So I think that, because of the way that HPOG is set up, it is the assessment of a national funding stream that includes, I don't know how much more to scale you can get than all of those programs. The second round of HPOG funding is in place. It includes even more programs, and that evaluation is underway too. So.
Hi, this is Hans Bos from the American Institutes for Research. I have a question for David. I was originally involved with this study like in 2007 when it first got started, and at the time we were worried about being able to recruit enough welfare recipients, TANF recipients, because the case loads were dropping so fast in those days, and it was really hard to conceive of a large enough sample across all these programs. And now the caseloads have continued to drop in most places. And you didn't really talk a lot about your sample characteristics. So I'm wondering, can you reflect on that? Are you changing who you bring into these studies, or are you still really focusing on long-term welfare recipients and like the most at need groups?
Thanks for that question, Hans. No, we're very much not TANF-centric in the PACE study. PACE, as Mark had described, and you might remember, we had this big stakeholder outreach process, and one of the areas of strong feedback that we got from that process was don't kind of get yourself boxed into narrow populations or populations that were tied to particular programs or even within other kinds of narrow categories. So we were looking for, and partly for the reason that you're saying, is that low-income adults decreasingly are using TANF and are existing in a sort of more, in a broader and diffused way. So we deliberately looked for programs that were trying to reach key segments of the low-income, low-skill adult population that without this boost of skills would not be likely to access post-secondary education. And each of the PACE programs that you can read about, each one of them had a somewhat different, well, very different sort of set of ideas about targeting. Some targeted lower, as the slides I showed implied. Some were targeting lower skills than others. And some had, one program was really looking explicitly to work with Latino families. That said, as I think I remember, the HPOG program does include TANF as one of the target interests. And as I remember, I think our three HPOG programs in PACE do tend to have higher proportions of TANF recipients. But one of the nice things about this set of studies is that they really are, we do have in our learning about a very diverse set of people.
So we are into our break time, but I'll invite one final question. But if you have others in the audience, if you have questions for the panelists, please ask them after the session.
I have just a simple question, really, just to know, in terms of the people who took the training and actually didn't get jobs in healthcare, are you doing follow-up to try and understand why they didn't get jobs in that area? I ask that only because employment and training programs are strongly criticized when people don't actually use the training, and that's used as an example of why they shouldn't be funded in some cases. So I'm just wondering how you're handling that from a methodological standpoint.
Well, I think in our intermediate outcomes follow-up, the 3-year follow-up study, we will be looking at patterns of career trajectories, and we have the opportunity to look at that there, and certainly some of the implementation study has examined more qualitatively some of those issues, and they have reports out as well.
Please join me in thanking our panelists.